You don't wake up one day with diabetes. Your body warns you first. The problem is, most people ignore those warnings. Here are 7 early signs you should never ignore. And here's the surprising part. Some of these signs don't even feel serious. Stay till the end. The last sign is the one almost everyone overlooks. Before we get into the signs, you need to understand what is actually happening inside your body, because most people think they already know, and most people are wrong. Type 2. Diabetes is not simply about eating too much sugar. That is the version the internet gives you, and it leaves out almost everything that matters. What is really happening is far more complex, far more gradual, and far more important to understand if you actually want to catch it before it catches you. At the center of this whole condition is a hormone called insulin. Insulin is produced by your pancreas, and its primary job is to act like a key, unlocking your cells so that glucose from your blood can enter and be used as energy. When everything is working properly, you eat, your blood sugar rises, your pancreas releases insulin, the cells open up, glucose moves in, and blood sugar comes back down. Clean, efficient, automatic. That your body has been running this system your entire life without you thinking about it once. The problem begins when your cells start ignoring that key. This is insulin resistance, and it does not happen overnight. It develops slowly, quietly, over months and years, usually driven by a combination of poor diet, physical inactivity, chronic stress, poor sleep, and in many cases, genetic predisposition. Your cells, particularly in your muscles, fat tissue, and liver, gradually stop responding to insulin the way they should. The key is still being made, but the locks are getting harder to turn. Your pancreas is not passive about this. When it senses that insulin is not doing its job effectively, it responds by producing more. More insulin, more pressure on the locks, trying to force the same result. For a while this works. Your blood sugar stays relatively normal because your pancreas is simply working harder to compensate. This is the phase that makes type 2 diabetes so deceptive. Your standard blood sugar test might come back completely normal, while underneath the surface, your pancreas is under enormous stress. Your insulin levels are chronically elevated, and your cells are becoming progressively more resistant. Then comes the point where the pancreas begins to lose that battle, and the beta cells, the specific cells inside your pancreas responsible for producing insulin, start to wear out from years of overproduction. Their function declines. Their numbers can even reduce. Now you have a double problem. Your cells are resistant to insulin, and your body can no longer produce enough of it to compensate. Blood glucose begins to stay elevated after meals, then between meals, then consistently throughout the day. And this is the moment type 2 diabetes moves from a background process into a clinical reality. And what makes this entire progression so dangerous is that chronically elevated blood glucose is not just a number on a lab report, it is actively damaging your body at a cellular level. Excess glucose binds to proteins and fats in a process called glycation. It damages the walls of your blood vessels, making them stiff and inflamed. It impairs nerve function over time. It strains your kidneys, which are constantly trying to filter out the excess. It affects circulation to your extremities. None of this happens dramatically. None of it announces itself with pain or obvious warning. It accumulates silently across years, which is precisely why the early signs matter so much. It is also worth briefly separating this from type 1 diabetes, because the two are fundamentally different. Type 1 is an autoimmune condition, where the immune system destroys the beta cells entirely, usually from a young age, meaning the body produces little to no insulin at all. Type 2 is a metabolic condition driven by resistance and progressive beta cell dysfunction. Different cause, different mechanism, different trajectory, and critically, far more opportunity for early intervention. Type 1 requires insulin from the outside to survive. Type 2, especially when caught early, can be significantly slowed, managed, and in many cases reversed through lifestyle changes alone. That distinction matters because it means what happens next is not inevitable. It means the signs your body is sending right now are not just warnings, they are opportunities. And understanding what you are dealing with at this level is the first step toward actually doing something about it before the window closes. The first sign is increased thirst, and it is one that almost everyone brushes off immediately. When glucose builds up in your bloodstream beyond what your kidneys can quietly manage, your kidneys begin working overtime to filter it out. To do that effectively, they pull water from your surrounding tissues and cells. Your body is essentially being drained from the inside, and no matter how much water you drink, and that dehydration keeps returning because the root cause, the excess glucose, is still there. You drink, you feel better briefly, and then the thirst comes back. Most people blame the weather, blame their coffee intake, blame not drinking enough through the day. But when thirst becomes persistent and disproportionate to your circumstances, your body is not asking for more water. It is telling you something about your blood sugar. And the second sign follows directly and almost inevitably from the first: frequent urination. There is a specific mechanism behind this called osmotic diuresis, and understanding it changes the way you see this symptom entirely. When glucose concentrations in the blood rise high enough, glucose spills into the urine. Glucose in the urine draws water with it osmotically, meaning your kidneys are now actively pulling fluid out of your body with every cycle. And the result is that you are urinating far more frequently than normal, often waking up multiple times through the night, and yet never feeling fully relieved. People dismiss this constantly. They blame hydration habits, bladder sensitivity, or simply getting older. But the combination of excessive thirst and frequent urination together is one of the most consistent early pairings in type 2 diabetes, and it deserves to be taken seriously rather than normalized. The third sign is fatigue. And this is the one that gets dismissed more than any other, because fatigue has become so common in modern life that people no longer even register it as a symptom. But the fatigue that comes with insulin resistance is different in character. Your blood is carrying more glucose than your cells can use, and yet your cells are being starved of energy at the same time, because insulin resistance is blocking the door. Your muscles, your brain, your organs, all of them are running below capacity, not because fuel is unavailable, but because the delivery system is broken. This produces a heavy, persistent exhaustion that is not solved by an early night or a strong coffee. It sits underneath everything. It makes concentration difficult, motivation low, and physical effort feel disproportionately hard. When rest stops restoring you, that is a signal worth investigating rather than pushing through. The fourth sign is blurred vision that comes and goes, and its mechanism is surprisingly direct. When blood sugar rises, excess glucose pulls fluid into the lens of your eye, causing it to swell and change shape. That change in shape alters the way light focuses on your retina, and your vision shifts. This is not permanent eye damage at this stage. It is a temporary, fluctuating change that tracks with your blood sugar levels. When sugar goes up, vision blurs. When it comes down, and things clear again, because it is inconsistent, people tend to attribute it to tiredness, screen time, or simply needing a new glasses prescription. They book an optician appointment rather than a blood test, and the underlying cause goes unexamined. The fifth sign is slow healing wounds, and this one carries real consequences if ignored. Elevated blood glucose impairs your immune system's ability to respond to injury and simultaneously damages the small blood vessels responsible for delivering oxygen and nutrients to your skin and tissue. A minor cut, a small blister, a skin graze that should resolve within days instead lingers for weeks. This is especially pronounced in the feet and lower legs, where circulation is already working hardest against gravity. The sixth sign is dark. In velvety patches of skin, medically called Acanthosis nigricans, appearing on the back of the neck, the armpits, or the groin. These patches form because chronically high insulin levels stimulate skin cell growth in friction-prone areas. They are not a cosmetic issue. They are a visible external marker of what is happening metabolically beneath the surface, and they are one of the most direct signs the body can show you that insulin resistance is already well underway. The seventh sign is belly fat that resists every effort to shift it, and this one is both a symptom and a driver of the condition simultaneously. Visceral fat, the fat stored deep around your abdominal organs, is metabolically active in the worst possible way. It releases inflammatory signals that worsen insulin resistance, and insulin resistance in turn promotes more fat storage in exactly that region. And the two feed each other in a cycle that lifestyle changes alone can feel powerless against, without understanding what is driving it. And that persistent, stubborn abdominal weight is your body's way of showing you that the metabolic conversation happening inside has been going on for longer than you may have realized. The reason most people miss the early signs of type 2 diabetes is not because they are careless or uninformed. It is because the human mind is remarkably good at finding alternative explanations for things that feel uncomfortable to confront, and the symptoms of early diabetes hand you those alternative explanations on a plate. Every single sign on that list has a perfectly reasonable, completely ordinary excuse sitting right next to it. And when life is busy and the symptoms are mild, the excuse always wins over the investigation. Take fatigue. In a world where exhaustion has become almost a badge of modern life, persistent tiredness is the last thing anyone rushes to a doctor about. You are tired because you work long hours. You are tired because your sleep is disrupted. You are tired because you have children, or stress, or a screen in your face until midnight. The fatigue of early insulin resistance does not announce itself as medically significant. It blends seamlessly into the background noise of an overstimulated, under-rested life. And because it arrives gradually rather than suddenly, there is no clear before and after moment where you can say something changed. You simply become accustomed to a lower baseline of energy and call it your new normal, never questioning whether that normal is actually a symptom. Thirst follows the same pattern. You tell yourself you have not been drinking enough water. You blame the heat, the season, the salty food you had at lunch. In isolation, feeling thirsty does not feel like a medical event. It feels like a minor inconvenience, easily corrected with a glass of water. And when that glass of water does temporarily help, it confirms the story you are telling yourself. That this is just dehydration, just lifestyle, just something to manage rather than something to investigate. And the brief relief the water provides is actually masking the fact that the thirst keeps returning, and that return is the signal that matters. Weight gain around the abdomen gets explained away with particular ease because the cultural narrative around belly fat is already so established. People are told constantly that weight gain is about willpower, about eating too much and moving too little, about the inevitable changes that come with age. So when visceral fat accumulates and resists effort, and the conclusion most people reach is a personal one, that they are not trying hard enough, not disciplined enough, not consistent enough. The metabolic dysfunction driving that fat storage never enters the conversation because the cultural story about weight leaves no room for it. People blame themselves and try harder at the same interventions that are not working, rather than asking why those interventions are not working. Blurred vision gets booked in as an optician appointment. Slow-healing wounds get treated topically with antiseptic and a bandage. Dark patches on the neck get written off as a tan, a skin condition, something to try a cream on. Frequent urination gets attributed to drinking more, to a small bladder, to age. Each symptom, handled in isolation, leads to a logical but ultimately misdirected response. And this is the core of the problem. These signs are never being looked at together. They are being managed one at a time, each in its own separate box. And the pattern that would make everything clear never gets assembled. This is how type 2 diabetes progresses silently through years in people who were never truly without warning. The signs were present. The body was communicating consistently and clearly. But the gradual nature of the symptoms, the availability of easier explanations, the normalization of feeling less than well, and the simple human instinct to avoid alarming conclusions. All of it conspires to delay the moment of recognition. And in a condition where early action is the single greatest advantage a person can have, that delay is never without consequence. Every month that passes without recognition is a month the metabolic dysfunction deepens, the beta cells face more strain, and the window for the simplest and most effective interventions quietly narrows without any dramatic announcement that time is passing. If you have recognized even 2 or 3 of the signs discussed, the most important thing you can do right now is stop treating this as something to think about later. Later is exactly how this condition progresses. Later is the whole reason millions of people move from pre-diabetes into a full type 2 diagnosis without ever making a deliberate choice to let that happen. The gap between knowing and acting is not neutral ground. It is where the damage accumulates quietly and the options available to you slowly begin to reduce. The first and most immediate step is testing. Ask your doctor for 2 specific tests: a fasting glucose test and an HbA1c test. The fasting glucose test measures your blood sugar after a period without eating, giving a snapshot of where your baseline sits. The HbA1c test goes further, measuring your average blood glucose over the past 2 to 3 months by looking at how much glucose has attached to your red blood cells. Together, these 2 tests give you the clearest possible picture of where your blood sugar actually stands, whether you are already in the pre-diabetic range, and how urgently intervention is needed. These are not complicated or expensive tests. They are available at almost any clinic or general practice, and the information they provide is more valuable than any amount of symptom watching or self-assessment. You cannot manage what you have not measured, and measurement is the first act of taking this seriously. Beyond testing, the lifestyle interventions with the strongest and most consistent evidence behind them come down to 3 areas. The first is diet quality, and the emphasis here is on quality rather than perfection. Reducing refined carbohydrates and ultra-processed foods has a direct and relatively rapid impact on blood sugar regulation and insulin sensitivity. You do not need an extreme diet. You need a consistent shift toward whole foods, adequate protein, fiber-rich vegetables, and a reduction in the foods that spike your glucose repeatedly throughout the day. Small, sustained changes in this area compound significantly over time. The second intervention is resistance training. And this one is genuinely underappreciated in most conversations about blood sugar management. Muscle tissue is one of the primary sites in the body where glucose gets absorbed and used. The more functional muscle mass you carry, the more capacity your body has to clear glucose from the blood efficiently and with less reliance on insulin. Even 2 to 3 sessions per week of resistance-based exercise produces measurable improvements in insulin sensitivity. And those improvements begin within weeks rather than months. The third area is sleep, and it is the one most people continue to deprioritize even after understanding its importance. A single night of poor sleep is enough to measurably impair insulin sensitivity the following day. Chronically disrupted sleep elevates cortisol, drives glucose dysregulation, increases hunger for high-carbohydrate foods, and actively works against every other positive change you are trying to make. If fixing your sleep is not a secondary concern, it is foundational to everything else working properly. Caught early enough, these 3 interventions together are not just supportive measures. They are genuinely capable of pulling someone back from the edge of a type 2 diagnosis entirely, and that possibility is worth every effort it takes to pursue. One of the most dangerous ideas a person can carry about their health is the belief that feeling fine means everything is fine. It is a completely understandable assumption. The human body is built to signal distress, and when those signals are absent or quiet, the natural conclusion is that nothing serious is happening. But type 2 diabetes is precisely the kind of condition that exploits that assumption, while operating beneath the threshold of obvious symptoms for years while the internal damage it causes continues accumulating without interruption, without announcement, and without waiting for you to feel ready to address it. The medical term for this is asymptomatic progression, and it is one of the defining characteristics of metabolic disease. Unlike a broken bone or an acute infection, elevated blood glucose does not demand your attention. It does not stop you from going to work, raising your children, living your life. It runs quietly in the background, and while it does, it is methodically degrading the systems that keep you functional over the long term. Your blood vessels are becoming stiffer and more inflamed. Your kidneys are under increasing filtration pressure. The nerves in your feet and hands are being exposed to a biochemical environment that slowly impairs their function, a complication known as diabetic neuropathy that begins far earlier than most people realize and far earlier than most people are diagnosed. Your eyes are accumulating damage to the small vessels of the retina. None of this produces a dramatic symptom in the early stages. All of it is happening regardless of whether you feel it. This is why the absence of pain is not permission to wait. People routinely delay seeking investigation because they do not feel sick enough to justify the concern. They tell themselves they will get tested when things get worse, not understanding that the entire danger of this condition is that by the time things feel worse, the window for the easiest and most effective intervention has already passed. Prediabetes is reversible in a way that established type 2 diabetes with complications is not. The earlier the point of recognition, the greater the range of options, the less aggressive the intervention required, and the more completely the trajectory can be changed. Waiting for symptoms to intensify before acting is the equivalent of waiting for a fire to reach the ceiling before looking for the exit. The silence your body is offering you right now is not clearance. See, it is a window, and windows do not stay open indefinitely. Every month that passes with unaddressed insulin resistance is a month of compounding metabolic stress that makes the next month harder to reverse. The body gave you the signs. It communicated through thirst, through fatigue, through skin changes, through a wound that would not heal, through weight that would not shift. It was never truly silent. It was speaking in a language that this entire conversation has been teaching you to understand. What happens next belongs entirely to you. The decision to test, to act, to take the early warning seriously before the condition decides the timeline for you, because eventually, if left unaddressed, it will